Hi, my name is Dr. Michael Putman. I'm a chiropractor practicing here in Roseville, California with my partner, Dr. Anthony Alberti. And we specialize in helping people that were in auto accidents recover fully from their injuries so that they don't have any residual problems later on down the line. I'd like to welcome you to our website entitled the Roseville Injury Center. And today what we're going to talk about is auto accidents. What happens during a car accident? What kind of injuries occur from the auto accident? What's the best way of treating those injuries, and whether or not you should seek legal counsel after an accident. So if you're watching this video today, you probably had a recent auto accident or know someone that has. If so, you might be wondering, where do I turn? What do I do after this accident? Especially if you've had some injuries. And we want to offer you a few solutions to that. First thing you should know, though, is what happens during an auto accident. With an auto accident, most of the injury occurs because of that rapid deceleration of the vehicle. When one vehicle strikes another, there's a lot of energy released, and most of the energy is absorbed by the vehicle itself. That's why they make these cars with these crumple zones to absorb the energy. But whatever's not absorbed by the vehicle is absorbed by the contents of the vehicle, namely the people inside of it, you and me. So when you have this rapid deceleration, this energy being released, our bodies are tossed around. Hopefully you've had your seat belts on and are stabilized, but still, even with that, your head and upper torso are moved very quickly and very rapidly. And this results in what's called soft tissue injuries. Occasionally result in fractures, but the most common thing is soft tissue injuries. So if you've had an auto accident, most likely you've had a soft tissue injury. Fractures do occur, but if you fractured your spine, hopefully they discovered that right at the scene and you're on a backboard and on your way into the hospital. If you fracture an arm or a leg or something like that, while it's traumatic, we do know that it's going to heal. You put a cast on it for 6 to 8 weeks, that bone will heal. It's a different scenario for soft tissue injuries. Soft tissue injuries involve spinal misalignments, sprains, strains, and microscopic tears. So when the body's tossed around very rapidly, before the muscles can adapt, joints are misaligned and jammed. Tendons, which attach muscle to bone, are stretched and torn. Ligaments, which attach one bone to another, are also stretched and torn. These are all soft tissue injuries. What happens with it, say with the neck, this is an example of a neck. On the left side we have a normal curve of a neck. This is an x-ray of a neck, person standing facing that direction in both cases. You'll see that they have a curve in their spine. That's a normal curve. They also have very nice and fat discs, and all their bones are equally shaped, and the nerves are all intact. Over here, this is a post-whiplash x-ray. The first thing you notice is that person has lost this curve in their neck. It's going the wrong direction. When that happens, we know that ligaments, tendons, and muscles are all stretched and perhaps torn, especially in the back part of the neck. These get stretched and torn between the vertebrae, and in the front they get crushed together. The disc can get crushed, the nerve can get damaged. All of these are soft tissue injuries. And the problem with these type of injuries is not only the immediate result of pain, but the long-term effects of healing with scar tissue and adhesions. See, anytime you have one of these injuries, this is a chart on soft tissue injuries and whiplash. But you'll see if you go up close looking at this chart that you could have these little fractures, you could have torn ligaments in the back, torn muscle, big old tear in the ligament back in here. Any of these injuries heal the same way. The first thing that happens is they get inflamed. Inflammation is this fluid that moves in and around the tissue, and it's a very thick, viscous fluid. It's almost like glue. And in fact, it has a lot of the same consequences as glue because it carries these cells in there that lay down scar tissue and adhesions. And the problem with that is that when you look at a muscle or a tendon or a ligament, they are all striated, which means they're all aligned. All the cells of the tissue, so this would be a muscle in here, are all aligned the same way so that they can elongate and stretch. When you get a tear in there, what happens is this inflammation moves in, this glue moves in, and it lays down a patch in what's called a haphazard fashion. It just lays down this patch like this. Well, now you can see what will happen when this muscle goes to extend or contract is it doesn't work right in this tissue. And there's 3 things that are bad about scar tissue and adhesions. One is that they are weak. 2, scar tissue is inelastic. And 3, it's absolutely loaded with nerve fibers. And these are open-ended nerve fibers that are sensitive for pain. Not a good combination. This is how people end up with chronic pain from car accidents. They get in an accident, they get sore and stiff, they go to the doctor, they get the typical treatment from the doctor, which is anti-inflammatories, painkillers, and muscle relaxants. And so they take those for a couple weeks and they start to feel better and they feel like, oh, I'm all better. While underneath, even though they don't feel it, this scar tissue is occurring. And what happens with this sticky adhesion scar tissue is that sooner or later it starts to get stretched and it starts to tear because it's weak. And it starts this pattern of chronic pain. Sometimes the scar tissue could actually adhere to a nerve, in which case they'll have problems going down their arm, if it's in their neck, might have numbness and tingling or pain in their hand. They could have headaches. All these kind of things are affected by the scar tissue. So when you want to try to heal these type of tissues, you have to be an expert in dealing with it. And because there's a multifaceted aspect of scar tissue, you have to take a multifaceted approach to it. And that's how our office is different. We incorporate chiropractic care, which works on the joints and helps with the nervous system to heal itself. We incorporate physical therapy to help strengthen and stabilize. We incorporate massage therapy, which helps break up that deeper scar tissue. We use neurological treatments to make sure that the nervous system is intact. Oftentimes with people, we'll use what's called exercise with oxygen therapy. Helps their body heal by using oxygen while they do some exercise. We'll also support them metabolically with some supplements that help your tissues heal. Now, if you get an injury and you go to a chiropractor and all they're doing is adjusting you, that's great, but they're not dealing with the stabilization aspect, and they're certainly not dealing with the soft tissue, scar tissue that occurs. If you go to a physical therapist, they're dealing with the muscles, and they will do a great job at it, but it's not enough. You also have to deal with these joint problems, otherwise you're never going to heal completely. So that's one of the things that we offer in our office, and that's why we're so successful with healing. To heal properly from an auto accident takes a minimum of 3 to 4 months from any type of minor to moderate injury. It takes longer, up to 6 or 8 months for a major injury. So those are things to keep in mind. We treat the patient as a whole. We want to prevent these chronic problems from occurring. And we do some neurological testing and treatment. We incorporate oxygen therapy to help you heal wholly and make sure that you stay healed. The last thing is that oftentimes patients come into our office after an auto accident. They want to know whether they should seek legal counsel, talk to an attorney. And we always encourage people, if they've had enough damage done to their vehicle or have injuries, they should always talk to an attorney. Now, we're not telling people to go out and sue somebody. That's a whole different thing. You want to find an attorney that will represent you to the insurance company's adjusters. Because remember, those adjusters working for the insurance companies, they do this for a living. They're professional, they know what they're doing, and their goal is to get you to sign their paperwork so you release them from liability, period, no matter how nice they may seem at first. Okay? So we always recommend to have an attorney on your side that can represent you and make sure you just get a fair settlement. Okay? The way to find an attorney, the best way is through a referral. So if you don't know any good attorneys, please call my office and talk to one of our staff, and we'll recommend 1 or 2 really great attorneys. We have several that we've worked with over the years here in the Sacramento region that are phenomenal attorneys. The reason we call them phenomenal is because they don't take things to litigation unless they have to. They're very good at communicating with the other side, with the adjusters from the insurance companies. Litigation is a lawsuit. And the reason some attorneys will use litigation is because they make more money doing it. But it's very stressful from the client, the patient's point of view. And oftentimes you as a client don't end up with any more money than you would otherwise. So one of the things to do when you're talking to an attorney, ask them what percentage of cases they take to litigation. That'll tell you a lot about the attorney. So the last thing is, what do you do next? You've had a car accident, you might be hurting, you don't know what to do. My recommendation is to come into our office and talk to us. We're very welcoming office. We're straightforward, no high pressure. We will talk to you, we'll do a free consultation, we'll do an exam to see if you have injuries from your auto accident. If you have injuries that we could spot on exam, we'll take x-rays of you and tell you what it's going to take to fix you and how long it will take. So our office is called Twin Creeks Chiropractic. It's located in Roseville on the corner of Sunrise and Eureka in the UA Theater parking lot. Our office number is 781-2600. Please give our office a call and make an appointment. We look forward to seeing you here. and we hope you heal quickly and well. Thank you.